The thicker one, so if you can say, if this one is the intestine, if we will take the circle as the intestine, so the thin one, the thin side will be in the mucous and the thick side will be here inside the lumen. So simply what this web worm is doing, it is basically attaching itself with the colon, and the posterior part is inside the lumen, which will keep on shedding eggs every day, every day. Okay. So the adult form is around 3 to 5 centimeter, or you can say 30 to 50 millimeter, and the female one is even bigger. Like as I told you here, the female one is even bigger than the male, right? This one is even bigger than the male. So uh, now the swift form is living in your intestine, right? In the large intestine. Simply, what they consume is still unclear. They don't know exactly what type of nutrition it takes. Okay, so but it does not seems like it consume our blood for its nutrition. Okay, so simply, guys, it takes around 60 to 90 days, or you can say 2 to 3 months after infection, then you will start producing eggs. So you can say once you will get infected, it will take 60 to 90 days or 2 to 3 months, like you will keep on uh, uh, producing, you can say, eggs. Okay, and the lifespan of an adult worm is about, I told you, 1 to 3 years, like even more. uh, so one good thing is simply, once it is here, it stays here. Okay, it does not goes anywhere. Like ascaris, when we will study ascaris, ascaris is the one which basically keep on moving, like it goes into the lungs, but this worm, it stays in the intestines. Okay, I hope you understand. Very simple thing, and very easy type of condition to understand. And what are the disease or clinical symptoms they cause? Many of the patients, they are asymptomatic, as I told you, depending on the load, how much you have. Maybe the only lab finding you will found at this point is the eosinophilia, which is always in parasitic infections. Okay, and as I was telling you that the children are the most severely type of infected uh, population. Uh, and why? Because children, there are higher chances, like they were going to take a bulk of worms inside their body, like when they play in the soil, and they don't wash their hands, so the worms can go into their body. So there are more chances that they will be what you can say heavily infected. Okay, and basically what they develop is called as Trichuris uh, colitis. Okay, so the inflammation of the colon is called as colitis. So basically, this one is, you can say, is the most, you can say, most common and major disease form which we are concerned. Okay, so now many of the patients, after getting infection, they sometimes develop something called as Trichuris dysentery uh, dysentery syndrome. And simply dysentery, what is dysentery, right? We have diarrhea, we have abdominal pain with blood and mucus, right? So they present with Trichuris dysentery syndrome. So they have like abdominal pain, they have diarrhea, they have blood, they have mucus. Okay, so the children, when they have severe type of dysentery, what happens, like they develop weight loss and bleeding, so they become like anemic. Okay, so simply like anemia, you can say anemia is common, and simply it results from both mucosal bleeding, because the parasite, it is going to penetrate the mucosa of the intestine. So it is going to be due to, you can say, bleeding. Okay, bleeding due to capillary damage. Okay, and of course, like there is chronic inflammation going on. So we call it as anemia of chronic disease. Okay, if you have done anemia, I think you guys know. So like the anemia is common but not so severe. Remember this thing, okay? Like in hookworm infections, anemia is more severe. Uh, okay, so if this one like Trichuris tricara is in the rectum, maybe the patient will present with a condition called as tenesmus. Not condition, rather you can say it's a symptom. So what is tenesmus? I will tell you. Like sometimes when we have diarrhea, we go like we feel like we must go to the toilet, okay, to defecate, and once we go to the toilet, we defecate, and we are coming out. Still, there is feeling that there is something inside, or you have to go to the toilet again. That is basically called as tenesmus, right? And one of the thing like tenesmus is common in these patients, and it can lead to rectal prolapse, especially in children. Okay, it can lead to rectal prolapse, especially you can say in children. Okay, especially in children. Okay, the important thing over here, I would rather show you. I'm sure, like if I will write over here, like maybe you will see Trichuris, Trichura. I'm sure, like you will get some photograph of rectal prolapse. So yeah, okay. Here, they are showing you a very what you can say. See how many intestines, like how many of the parasites are there inside the rectum area. So what is rectal prolapse? Basically, the rectal mucosa bulges out from the what you can say, from the anal canal or from the anus. Okay, so the mucosa of the rectum, it bulges out from the anus. That is called as the rectal prolapse. So this thing can happen, right? So these are the causes. You can say like these are the features of acute trichuriasis. Okay, and then there is something called as chronic trichuriasis. Okay, so what happened in these patients? This is the condition which looks like inflammatory bowel disease. So like I am sure like you guys don't know about what is IBDs. Okay, Crohn's disease or ulcerative colitis, right? So you can say looks like inflammatory bowel disease. So of course, like it's an inflammatory condition of the bowel, ulcerative colitis and Crohn's disease, which runs for so long, and the patient can present with bleeding and multiple signs and symptoms. So simply like anyone who have chronic trichuriasis, what happened, like they have chronic malnutrition, they have short stature, their height is not so big, they may have finger clubbing. Okay, so this thing this one is like the thing. And the good thing, once we when the child is still in the growing age, and if you will give them some deworm drugs like to kill this one trichuriasis, so they gain the height quickly. Okay, so this is the important thing. So again, like this Trichuris triquera, it also can give the inflammatory response, and the eosinophils will be raised, and there will be what you can say, this inflammatory response can be, the signs and symptoms can be present in the body. So anyways guys, like how we diagnose this condition, how the diagnosis is done, microscopic identification. Okay, microscopic identification of what? Of course the stools. And what they see? They see the Trichuris eggs. Okay, and now as I show you the eggs, they look like lemon. They are lemon shaped, thick shell, and mucus plug on both ends. So quite characteristic. The important thing you know, as I told you, they can produce a lot of eggs every day. Okay, so when the egg output is very high, you can say 200 eggs per gram of feces. Then uh, like per worm pair, by the way, per worm pair, very important. So then it can be seen by what you can say, uh, by a simple fecal smear. They can be seen. We can do CBC, of course, like there will be eosinophilia, and for example, one of the diagnoses can be done. For example, if someone is presenting with rectal prolapse, and of course, like you can examine them rectum, and you can found, for example, you can see or identify worms in the rectum or in the rectal mucosa. Okay, because they are embedded in the mucosa, as I show you. Okay, so or you can do a colonoscopy. What is colonoscopy? Like they put a fibroactive tube inside your anus and they see your intestine from inside. Okay, and as you know, like the males are the one which are rounded and the females are the one which are straight. Okay, so this thing is there, and simply always sorry, wait, very important point, guys. I told you it comes with co-infection, so always uh, look for co-infection. Co-infection with what? Ascaris and different hookworms, right? Because they are present most of the time together. So this thing is important. Um, and the important thing, like we can do ESR and this thing, and yes, and other investigatory methods are you cannot say, like, not too much. Okay, so now simply anyone who have this trichura infection, we can do all this investigations, right? One of the things they show on sigmoidoscopy is something called as coconut cake rectum. I don't know, like, if we can found this thing on Bing or not. Like, it is called as coconut cake rectum. I don't know, like, we can see any photographs of that or not. Yes, you can see. See, this is like the coconut cake rectum. Seems like this one have coconuts. Okay, see, a lot of worms are attached to the bowel mucosa. Okay, so this thing. How we treat, guys? Very, very, very easy. Okay, how we treat this condition? Treatment is very easy. So treatment, how we treat? Simply, um, the treatment is done by benzimidazoles. Okay, these are the drug of choice, and what they do, like, basically, these are the drug of choice because they are quite effective. What they do, like, they inhibit the microtubule polymerization inside that worms, and you can say a single dose of, we can give albendazole, for example. Okay, albendazole is present all over the world. Okay, and it comes by the same name, albendazole. Like, most of the company names are almost similar to this one. So when we give a single dose of albendazole, okay, what happens, like, uh, like the worms started killing, and the studies says that you have to give multiple doses of albendazole to decrease the burden of the infection. So what we do, like, most of the times, we can give albendazole, we can give mebendazole. Of course, like, they all belong to the same group. So for example, mebendazole is given for 2 times daily for 3 days. Okay, and the cure rate is around 90% in these patients. So simply we can give albendazole or mebendazole, and they are well tolerated drugs, and they have some side effects like abdominal pain, nausea, vomiting, diarrhea, uh, and some very rare serious toxicities are also there. But uh, like these drugs are those which we give to these patients. But remember, these drugs are not recommended in pregnancy. Okay, so uh, if the women's they come into in pregnancy, so we what you can say think like either we should give this medications or not. Okay, we can wait for what you can say for the pregnancy to finish, and then we can deworm them. Okay, so how we prevent this condition, how the prevention can be done now, of course, like good sanitation. Okay, good sanitation is the important thing. Drink clean water, properly clean food, drink clean and drink clean water, and properly washed food, as well as hand washing is important, right? Now, see, hand washing plays a role in this one. Uh, Wearing shoes, especially if you're going into the soily areas, because the shoes can bring that thing in your home. And sanitization can be done in the places. Okay. Like one of the thing, like, when there is direct sun's exposure for greater than 12 hours and the temperatures are more than 40 degrees centigrade. Okay. So that is enough to kill the embryo. Okay. So 12 hours of direct sunlight with 40 degrees centigrade Celsius, okay, is like enough to kill that one. So, but still, there are places, which are under the shade, or where the sunlight cannot reach. So, of course, like in that one, these eggs can still be viable for many months. Okay, so these eggs are quite resistant to chemical disinfectants as well. Okay, so even like the if the sewage water is treated, so many of the eggs they can escape. So nowadays, of course, in most of the countries, not most, but like in many of the countries, the sanitation is very, very, very good. And uh, this problem is worldwide, and that's why the WHO it says that uh, that they should treat the soil with, you can say, anti-helmintic drugs. Okay, and the WHO also recommend in underprivileged areas that the children should be given, like the school going children should be given anti-helmintic drugs time by time to deworm them. Okay, and the goal is simply to keep the worm burden as less as possible in these kids. So this is what we can do, and albendazole, mebendazole are available worldwide, so that's a good point here. So, and the reinfection is common. So remember this thing, that the reinfection is common thing. Prevention. This is prevention. Okay, prevention. Sorry. So reinfection is common. So it doesn't mean like once you will get this one, you are immune. No, you can get a like again. So, but the best thing, of course, we can do is like improve the sanitary conditions. That's the most important thing. And of course, like in the countries which are underprivileged, like in which like they don't have like, or poor countries you can say, which cannot improve the sanitation, so we can use albendazole or mebendazole drugs time by time in the school going children especially. And the single drug dose is not enough, so we have to give multiple dosages. Okay, and that's why I told you mebendazole is given for 2 times per day for continuously 3 days. So anyhow, thank you so much guys for listening to this lecture, and I hope you understand this condition.